Okay, it looks like we're streaming live on YouTube. Good morning, everyone. It's Tuesday, September 29th. Thank you for joining us today for this media briefing. Today, we'll get an update from Medical Officer of Health, Dr. Hsiu-Li Wang, and then I will provide you with an enforcement update, and then we'll go to your questions. So we'll get started with Dr. Wang. Go ahead, Hsiu-Li.
Thanks, Julie. So good morning, everyone. As of this morning's update, there are 156 active cases, a total of 1,031,000. Oh, I'm sorry. I'll repeat that. A total of 131,533 tests have been performed in Waterloo region with positive results for 1.3% of all tests. Please note that we have switched the data source for our testing data, so you will have noticed a pretty large one-time jump in test counts on our dashboard. We are now collecting the testing data from a provincial database called OLIS, which captures both the testing from our local testing centers, as well as test counts from enhanced surveillance. That's the regular testing at long-term care and retirement homes. This data source gives a more complete picture of testing across our region. Earlier on, this provincial database was undercounting the number of tests done in the region because there were a number of labs which our samples were sent to, which were not on the system yet. So our assessment center counts were more accurate. Now, the reverse is true, and these numbers from the provincial database are the most accurate numbers for our region. One case is currently hospitalized. There are currently 7 active outbreaks, 1 in a congregate care setting, 2 workplace settings, 3 licensed childcare settings, 1 in a school. We have also added a new category for transmission type for cases still under investigation. Previously, community transmission was the default for cases still under investigation until another transmission type was identified as part of our case investigation. This meant that the transmission type was subject to change. The new category allows us to report the cases without assigning a transmission type until our investigation is complete. Changes to testing. So last week, the province announced changes to testing in response to the increased demand for testing. Only seek testing if you are showing COVID-19 symptoms, you have been exposed to a confirmed case of the virus as informed by public health, or you have received a notification through the COVID Alert app. This includes individuals requiring a test to return to school or daycare. Continuing with the criteria, you are a resident or work in a setting that has a COVID-19 outbreak as identified and informed by public health. You are required to seek testing as directed by the Ministry of Health or the Ministry of Long-Term Care. This includes individuals wishing to visit someone in a long-term care facility. And finally, you are required to be tested before international travel. If you do not have symptoms and do not meet any of these categories, please do not seek testing at this time. Regarding Thanksgiving, with cases on the rise across Ontario, large family gatherings will increase the spread of COVID-19. The virus is spread by people, and it spreads easily in social settings where people may feel more relaxed about following precautions. We have a collective responsibility to protect each other. You can protect yourself and your loved ones by making plans to celebrate Thanksgiving safely. Plan virtual or shorter visits without a meal. Or if you choose to share a meal together, here are some additional measures to consider. If dining inside, keep the windows opened, weather permitting, to allow for increased airflow. Clean and disinfect high-touch surfaces often. Practice proper hand hygiene often, especially before eating. Even if your event is within the provincial indoor and outdoor gathering limits, if there are people from more than one small social bubble, ensure people are practicing physical distancing and wearing masks when not eating or drinking. Again, please do not plan larger gatherings. Small is safer. In closing, with your sustained commitment to the public health practices, the virus will slow. Your actions make a difference in our community. We need to recommit to small social bubbles. I encourage all of us to keep our social bubbles small. Due to the pandemic progressing in Ontario, even though the limit in Ontario is 10 at this time, I would encourage those of us who can keep it smaller to do so. And as a reminder, it's the same small group of people in our small social bubble all the time, not different groups at one time. It's the same group all the time. So please continue to practice physical distancing with anyone outside your small bubble and wear a face covering. This includes family gatherings or while visiting friends. Finally, I want to take a moment to acknowledge the work of our partners ahead of and during homecoming weekend, and acknowledge the students in our community who committed to following public health measures over the weekend. We all have a role to play in flattening the curve for our community. The actions we take today will determine our future. By all of us coming together, we can slow the spread. Thank you.
Thank you, Hsiu-Li. I'll now provide you with an enforcement update for the dates from September 21st to 27th. So first, starting with public health actions, we had a total of 100 complaints, 92 that we did education and warning on, and 16 that we did actual site visits. With the face covering bylaws, we ended up having 105 total complaints, 103 which were followed up with education and warning, and 2 which were site visits. One of the changes this week is that there was one enforcement action that we wanted to report to you. So a ticket was issued on Friday, September 25th, for observations made during the hours monitoring on September 13th. This was at a location called Meltwich in Waterloo. The charge was fail to comply with continued section 7.0.2 order. Sorry, you can tell I'm not used to doing these. Under the Reopening of Ontario Act, and it was a $750 ticket. So that's the enforcement update for all of you. I'll now turn it over to you for questions, and we'll start with Nicole from CTV. Go ahead, Nicole.
Hi, quickly for the enforcement, what was the order that they broke for Meltwich?
I think
You want me to
Julie, I think you mentioned it, right? It's
Yeah.
failing to comply
with section 7.0.2 order. So that's in the Reopening of Ontario Act.
So the requirements of the Reopening Act, you know, the different requirements that restaurants or establishments like that have in terms of, see if I can. Just a general, you know, measures related to physical distancing.
Actually, I have something here, Hsiu-Li. Sorry, I was just reading through the notes. So the non-compliance observed on September 13th. So it was regarding people not remaining seated. You know, the number of seats or types of seats that are made available, and physical distancing, as Hsiu-Li noted.
There you go. Thanks, Julie.
So when it comes to contact tracing, is it now a major challenge for public health? On average, how many people do the nurses have to contact now per case compared to how many you had to contact back in April?
Thanks, Nicole. So in general, with more cases, it will become more challenging, especially if they have more contacts, which is why we've been trying to ask people, you know, to have close contact with less people outside of their social bubble. And when we started having a lot of new cases in September, we noticed that as a trend, this is not the case for everyone, but as a trend, there were a number of people that had a number of contacts, you know, with a lot of people without physical distancing, without wearing masks. And so when you, so in general, we've had to follow up with more contacts per case. Now it will vary for each case. It can fluctuate quite a bit for each case, but that was a general trend. And we're starting to see a little bit of people scaling back now in our more recent cases, which is good. So that's why we really want to keep the emphasis on trying to keep our social bubbles small, the things that we can control, keep them small. And, you know, this will mean that there's less contacts to have to trace. But overall, yeah, if cases rise rapidly, it can be straining for health units to follow up, especially if there are more cases. I'm sorry, especially if there are more contacts per case.
It just sounded like moments ago you were following along the same line of Toronto's medical officer of health, who basically said, forget a bubble and just now stick to the people in their household. That was a call that she made for Toronto.
Mm-hmm.
What are your thoughts on that request? And, you know, would you say now that you're asking for a smaller bubble of 10, are you saying for people just to stick to the people within their home?
No, that's not my message at this time. Currently, the recommended limit in Ontario is 10, but what I'm trying to encourage is for those that don't need to go to 10, that can keep smaller bubbles, that you know, they do so at this time because the pandemic is rising in Ontario. There are downsides also to having your contacts only be your household contacts, right? It's difficult. Some families, for example, you know, have loved ones they that are right outside of their immediate household circle, so to speak, but for which it's important for them to be in contact with, to be able to visit, and so, you know, I would just say this will be a personal family decision. But overall, if people can reduce their contacts as much as possible, not their contacts with, you know, distancing and masks, but their there's social bubble in which you don't distance and you don't mask, if people can reduce those social bubbles to as small a number as they can, which for some people will be only their household contacts, then I would encourage that.
Moving on to St. Jacob's Market, it was packed with people this past weekend. And while there are safety measures in place like arrows and sanitizing stations, is it enough when there are that many people present and physical distancing is not always possible? And do you think more rules need to be in place for staffed businesses and facilities like markets in order to ensure public safety?
Okay, thanks for the question. So we have been working with St. Jacob's Market, and we have also heard of the complaints and the concerns. And, you know, because of their size, as per the regulations, they're allowed a certain number of people, and they are keeping it to that number of people. And in fact, they've also lowered it even more so, just because they, you know, they want to try to, you know, reduce instances of potential crowding. You know, we continue to work with them. It is something, you know, these are numbers that can look pretty big because of the fact that they are a big space. You know, they're putting in place the required precautions, but there are, you know, some areas we've heard some concerns about where crowding is more likely, and so we are currently working with them on those areas in particular.
Now, we've heard from other jurisdictions,
Mhm.
leaders there saying education time is over. People have been told since March about public health measures. Does Waterloo Region Public Health agree, and will you ask bylaw and police to be more assertive to enforce fines when it comes to people breaking public health measures?
Yeah, you know, we've been very fortunate in our community. We've had such great support from our enforcement partners like bylaw and police. And, you know, we don't have to tell them anything. They already know that, you know, there's been a lot of education. And if people are not complying or there's a blatant disregard for requirements, then they will act. And so, yeah, they're already taking that approach.
One last question. We noticed there was a case at Kids Ability. It's listed under the province as a school case. I'm just wondering if for the region it's considered a childcare setting. And if that's the one case, is that considered an outbreak there?
No, it's considered a school setting as I understand it. Trying to, yeah, as I understand it, it's considered a school setting.
Okay.
Yeah.
Okay, thanks, Nicole. We're going to move on to Matt from CBC. Go ahead, Matt.
Hi, Matt.
Hi. With regard to contact tracing, how are you keeping up with the demand, and how much can cases increase in the trajectory that we're seeing before you're overwhelmed?
So thanks for the question. So when we have increases like this, we take measures such as, you know, redeploying staff, and we're also bringing on additional staff for contact tracing. And you know, the province also has some assistance that they offer in those situations. So we're taking advantage of all the avenues. Yeah, you know, we are working to continue to keep up. That said, it's true that if cases rise rapidly and cases have many contacts, then it will be harder and harder for health units to keep up. You know, it's something that that's important for people to understand is, you know, contact and contact tracing can be very effective tools, but you have to keep community transmission rates manageable. Because if you don't, and there's very widespread infection and the numbers are escalating rapidly, you know, it's going to be difficult, even with more contact tracers, to be really able to clamp down on areas as quickly or as precisely. really, it's one part of the response, but a really, really key part of the response, the most important thing I would say is that everyone in our community try to do whatever they can to practice the public health measures so that we can slow the spread of the infection. And that will then keep the new cases that come up to a manageable level, where case and contact tracing can be very effective.
Okay. You said you'd maybe bringing on more contact tracers. Can you say how many and on what timeline that's going to happen?
We're just, we're in the process of recruiting. I don't have an exact number. We've already started the process. We're just continuing to bring on more staff as needed. And we're also, as I mentioned, taking advantage of an offer from the province to help out with some of this contact follow-up. And we're redeploying staff internally. It's a very fluid situation. I myself don't have an update all the time on exactly what the numbers are.
I'm sorry to interrupt you there. I left it, I forgot what it was. Oh, so I guess with this is maybe a plan that was already instituted from the first time around. Like you said, there's a redeployment going on, and there's people being brought on. And I suspect that once you saw cases starting to go up, that you maybe got into action.
Yeah, that's correct. Yeah, I mean, it was earlier than I think a lot of us expected. And it as we've seen, it can go up pretty quickly. So, it's something we have to just really be very agile in response to. And, so it's a good thing we had plans to scale up already for the fall, and we were acting on those plans already. But we've had to continue to make adjustments, like further redeployment of staff in the short term, while we wait for some reinforcements to come, either from our own hiring or from the province. The key thing really is, let's work together to keep those community transmission rates lower, and then case and contact tracing can be as effective as they're designed to be.
Great, thank you very much.
Thank you, Matt. We'll move on to Joanna from the Record. Go ahead, Joanna.
Thank you. Dr. Wang, you brought up Thanksgiving, which is 2 weeks away. Are you concerned about it, and that's why you want to get the message out early?
Yeah, I'm concerned about it. I think understandably, the situation in Ontario even 2 weeks ago was different, and people were making plans. And I know that, it's an important holiday for a lot of people, and it's never easy to tell people, change your plans, think about having less people or no people. So I wanted to, I am worried about Thanksgiving because of what's happened in Ontario, because of how rapidly we've entered the second phase, or second wave, I should say. And I know people have been planning larger gatherings, so it's really to try to ask them now to make sure that as much as they can to keep their gatherings small. Too many gatherings or too large of gatherings will fuel further spread in Ontario as well as Waterloo region. So I am concerned, yes.
And you talked about people planning large gatherings. Even 2 weeks ago when things were different. Are you worried that because people have sort of changed their habits and gotten away from what we had been doing, that it's going to be hard to get back to that? Like, are people just in this new habit now of socializing more?
Yeah, you know what? I do think you're right that people are more into this habit of socializing more, and it's not going to be easy to change. our case investigators have been telling me that it seems to be starting to change. There's more people conscientious now of the need to scale back and recommit to our public health precautions. And so, I'm hopeful, and that's why I'm trying to keep getting the message out there. At this time, we really need to be planning for small gatherings and trying to reduce where we can the number of people in our social bubbles. And if we have more people, make sure we physically distance and wear masks. Sorry, yeah. Sorry, go ahead.
Sorry, I was just going to ask a question for a colleague. I know you explained at the beginning about the testing numbers.
Yeah.
And kind of why things have gone back and forth and which is reliable at certain points. Are you concerned then that anyone in the community who's following these numbers, because they're reported every day, people look at the dashboard and kind of take it as gospel, that they're going to not have faith in what you guys are reporting just because, there has been sort of dramatic jumps in the testing numbers alone?
Yeah, no, that's a fair question. I mean, I think one of the things to be aware of as a contextual piece is the laboratory system to process these tests has gone through a great expansion during the pandemic. So that's a good thing, because now in Ontario, we can process a lot more tests than we could during wave 1. I know there's been bumps in the road, and there's still bumps now, but overall, they've greatly expanded. And in the beginning, not all labs were on. And unfortunately, in Waterloo Region, we had many of our tests that were not on. So we had to use a system where we were trying to collect data from the people we knew were doing the testing and manually putting that together and showing the numbers every day. I understand this is a very big jump, and it raises those questions. But as the lab system became better and was built and more labs went on, we became aware that, now this new provincial system with the labs that are on it now would be able to more accurately reflect the numbers in our region, because they took into account not only the tests at the assessment centers that our assessment partners can give us. And sometimes they didn't give it to us they weren't able to give us to us right away because they were really busy. So sometimes there was a bit of a lag. But in addition to those tests, all the other tests that were being done by the long-term care homes, retirement homes, that went straight into the lab system, and before weren't being captured, but now they're being captured by this provincial database. And so, yes, it can seem like a very significant shift, but I would say that we're trying to provide the best source of data that we're aware of at the time to keep our community informed. And when there are changes like this, even though it constitutes a big change, we want to roll it out so that people know, okay, now, this number is a better number. And so we're going to be using this number going forward.
And sorry, just one follow-up question.
Sure.
Okay.
For sure.
So for you guys then, when you say on Friday with the number that you guys had versus the number today, did you have an inkling that it was off? Because we were way behind the provincial numbers.
Oh, that's actually earlier. I was wondering how we're doing compared to the province. That was what we were monitoring this thing, and we were happy to hear that now this provincial database has all these labs on it now. The labs that were missing before that our tests were going to, a large number of these labs at least that our tests were going to, and so now they were able to track these. And now we looked into this and we felt like this number is a number that's both more reflective of the actual number of tests as well as a number that's reliable going forward. because now all the labs that our tests go to are on the system.
Okay, thank you.
Thanks, Joanna. We'll move on to Ben from 570. Go ahead, Ben.
Thanks very much, and good morning, Dr. Wang. Hope you're well. Let me just pull up my questions here.
Yes.
I have a clarifying question here to start off. Do you have the power to impose new restrictions in Waterloo Region separate from the province?
Yeah. Medical officers of health have they have general powers that if we feel there is a local situation that is unique or there's a local threat that is more significant than elsewhere and that warrants additional measures. There are legal avenues for medical officers to pursue that. It's not something that's often done, but it's always an option that's available to us. But it really depends on whether we think there is something that's needed for this region because there's a particular local risk that is relevant to this region that the provincial guidance wouldn't cover.
Okay, does that also include more sweeping rules? Like, for example, would you be able to reimpose restrictions like we saw in stage 2, or is that up to the province?
Oh, restrictions like stage 2, they're so big that legally it would be, it would be much more appropriate for the province to reimpose. A local medical officer overturning provincial regulations would be, I would imagine, very complicated legally to do if it were all possible. But in terms of adjusting somewhat, modifying somewhat something provincial in order to accommodate a particular local threat, for example, that's more unique to this area, then that's really what the orders of medical officers are designed for, not to make sweeping policy changes that affect broad swathes of the population that normally would be done at a provincial level.
Okay, thank you. That does help. I am wondering, do we know what our testing backlog numbers are specific to Waterloo Region?
No, we're not. We only know what the backlog is provincially.
Okay, fair enough. My third question is on kind of a completely different note here. Now, as far as Oktoberfest goes, we saw a bit of a situation on the weekend with a picture being posted with a couple of people doing a shot ski. We're just kind of wondering for clarification, is that something like that in the jurisdiction of public health, or who is that up to?
Yeah, it's in the provincial regulations for reopening of restaurants and food and drink establishments. And it doesn't cover every type of activity that might happen, but in general, people are not to be standing and drinking, standing and socializing. The regulations for the reopening require that unless people are standing because they're coming into the restaurant or leaving the restaurant or going to the washroom, for example, in those specific circumstances, they're allowed to stand, but otherwise they need to be seated. So, it's something we're working on, for example, through KW Oktoberfest to help us sort of reinforce with all participating venues. So, it's just a general concept that people shouldn't be standing and doing things like standing and drinking and standing and socializing, because currently that's not allowed under the provincial reopening requirements for restaurants.
Is there any sort of general message that you'd like to get out there to those participating in October?
Yeah, I would say, thanks for the opportunity, Ben. I would say that, the Oktoberfest has been working really hard. And I know it's not just like there's Oktoberfest and then there's a whole range of, participating restaurants, for example, that are, participating as part of the celebrations. And obviously, everyone has to make sure that they themselves are following the requirements. It's up to each individual venue to do that. But I would say that by and large, I mean, our hospitality sector is really trying very, very hard to adhere to the rules. I mean, from time to time, there are some people that are not following the rules, and if not, they we will follow up and take enforcement action as needed. But the vast majority of the restaurants and the people in our hospitality sector are trying really, really hard, and they are following the rules. And sometimes, they may misunderstand or they might not be aware. And so we have to go in and just educate and make sure they understand and get the message out. So I would just say that, from what we've seen, our inspectors go out there, we see a great effort to comply. We see very good compliance overall, and there are times we need to make some, we need to make some reminders. Sorry, we need to make some, ask them to make some adjustments and give them reminders about what's allowed and what's not allowed.
Okay, perfect. Do you mind if I ask just one more
Sure.
question here about schools? Thank
Sure,
you.
yes, of course.
As far as schools go here in the region, now we did see that one completely shut down in Toronto. Just for us locally, I'm just wondering, at what point would a school actually be shut down? Like, we've seen outbreaks declared,
Yeah.
but how bad would an outbreak have to be for the whole
Yeah.
school to have to be shut
Yeah.
down?
It's a good question, Ben. So there's no set number. It really depends on the assessment of the health unit about whether or not, we find that the evolution of the outbreak is such that we need to actually shut down more classes or shut down an entire school to bring the outbreak under control. So if we have a sense that without shutting down more classes, without shutting down an entire school, we're not going to be effective at bringing an outbreak under control, that's when we would recommend that, those type of measures be put in place. Right now, what we're seeing in our region is that the strict measures that are in place to, address a case that appears or an outbreak that may appear, they're strict, and so far so good, right? They're keeping, further spread at bay. But there could come a time when we have a particular situation in a school where, things are spreading and we feel we need to put in place more measures than what's been put in place to date in the schools that we've had cases in. And if we feel it's spread to the point that we need to close down a school to control the outbreak, then that's what we'll do.
Thank you very much. That's all my questions right now.
Okay.
Okay, thank you, Ben. Damon, I know that you're listening in. Did you have any questions for us?
Yeah, I can speak now. So my question is, when do we expect to hit our peak of the second wave?
Yeah, no, that's a good question, Damon, and it gives me an opportunity to say, one, we'll never know when we've hit a peak until we're past the peak and on the way down. But two, the size of the peak depends on us. Different people can have somewhat different definitions of what a second wave is and what a peak looks like. So basically, a wave is just, the way that I define it, is just we are seeing this escalation, this rapid escalation of cases, but how big the wave will be, how long it will last, depends on how well we as a community overall adhere to the public health measures, and of course the types of measures that are that are put in place as well. So, you know, what I'm hopeful for is that even though the second wave has started in Ontario, we ourselves had escalating cases in the last couple of weeks, that, you know, our rate of growth can slow, as it seems to be doing a little now, but we have to be very careful and keep monitoring. And then, you know, the wave doesn't need to be big. And so, yeah, so how big the wave will be or when we'll reach our peak, that is very dependent on how we act as a community, how much we adhere to the guidelines.
Okay, and then with cases reaching some of their highest points yet, is it okay for us to be running as we are? Do you think there should be more rollbacks in how operations are being done?
Yeah, operations overall, like what's opened and what's not, things like that?
Yeah.
Okay, yeah. So the strategy overall in Ontario, which I agree with, is we don't want to use a blunt instrument like broad closures once we start getting cases, because we know there's serious impacts in other ways when we have these broad closures like we did in the spring. So what we're trying to do is address the measures that, you know, in our case investigations across the province as well as locally, address the measures that we think are driving these increases, so we can be selective and we can target those areas more specifically in order to reduce impact to other areas. So rather than closing down all establishments, you know, if there are certain issues that we're seeing and we think further restrictions in one particular area will be better and will help, we're going to apply those restrictions there. So that's basically what, you know, the province has been doing. They've been more selective. And I do think it's a good thing because we are trying to maintain this delicate balance where a lot of what we've gained back in terms of reopenings, you know, not only like reopenings of businesses, but reopening of care facilities or the gradual lifting of restrictions in those care facilities, the restart of medical procedures, you know, in hospitals and elsewhere that were delayed or put off in wave one, the reopening of schools, et cetera, all of that, those are things that we've gained back, you know, over the summer months. And we want to try as much as possible to keep those areas opened while not escalating the rate of COVID cases. And so that's the goal. And, you know, if we can keep the rate of infection in Waterloo region at a manageable level, then we can maintain that balance. And, you know, that is the best case scenario, that we have a relatively slow burn of infections appearing, and we're able to address them quickly, you know, case and contact management, outbreak management. We can keep those rates, you know, manageable in that way. Then we can keep a lot of things opened. And so we are in a precarious time because of the fact that, you know, the pandemic, the second wave is here in Ontario. Our cases, as we've seen, can escalate quickly. And they seem to be doing that in more and more places in Ontario now. So we're in a situation that's higher risk than in the summer for sure. And what we're asking people to do now is to recommit to those public health measures, double down on them, because we've seen that when we do that, we slow the spread of infection. So our main priority right now is to get the rate of spread under control, to slow the spread. And the most effective means as a community to do this overall is to practice those public health measures and, try to make sure that our social bubbles, the ones that we don't practice physical distancing and wearing a face mask with, those people in our social bubble, we try to keep them as small as we're able to.
Okay, and then just one last question. With some pharmacies offering testing now in the region, or going to be, do you have concern that, say, like a store patron will pick up the virus from someone that's carrying it going to be tested?
Yeah, so the province has put in place, rules for people that would like to seek testing at a pharmacy. I should say one rule in particular, which is that they are not symptomatic, and the pharmacists themselves, in order to set up the areas to be safe for taking the test, they have all of these other rules that they have to follow. So measures are being put in place so that it's not a riskier environment for people that are going into a pharmacy. And one of the key measures is that the people that can get a test at a pharmacy have to be asymptomatic and have to book an appointment and pass a screen ahead of time, confirming that they're asymptomatic before they can get a test.
Great, thank you for the clarification.
Okay, thank you, Damon. So we've done one round of questions. We have about 10 minutes left. Anyone else have any questions? Okay, Nicole, go ahead.
Hi, I'm just wondering, it's expected that the province will announce PSWs for, or more money for PSWs in long-term care. Since Waterloo Region was home to one of the hardest hit long-term care facilities in the province, I'm just wondering, are you guys enhancing or doubling down? What are you guys doing as we go into this second wave to ensure that there aren't any major outbreaks like we saw at Forest Heights this time around?
Yeah, so the homes are overseen by their own ministry, but as was the case in the first wave, health system partners locally continue to be there to help support, and we're continuing to be we are connected. It's not public health, really. That's the lead, so to speak. But we are part of a group of health system partners that are trying to assist where we can, to provide more supports to them. So, for example, we will be continuing our role in helping them, like we're doing right now. Every time they have a case or they have an outbreak, we're there to support. The homes are also better prepared than they were in the first wave, right? We've noticed that their ability to respond has improved, but they're going to keep improving over time as well, and we're going to continue to be there along with other system supports like hospitals and home and community care, who are more involved on the personnel side. So if, for example, a home needs additional staffing because they're in an outbreak situation, they've lost a few staff due to staff either being ill or having to self-isolate, then they will reach out to other system partners like the home and community care, the LIN, in order to try to prevent staffing shortages. So that's where those other organizations are involved, but we're all speaking to each other and keeping each other informed. And in public health, we're continuing to provide support, as we always have, for outbreak management.
Okay, is that it, Nicole? Yep. All right, Ben, you had your hand up. Go ahead, Ben.
Thank you. I'd actually just like to follow up on Nicole's question. I'm wondering,
Sure.
Dr. Wang, is there specifically more focus on those homes that were hard hit, like making sure that they have additional policies in place, such as those ones who have not been upgraded, like Forest Heights? And if we do see an outbreak at Forest Heights, will there be earlier action this time, such as moving residents out?
Yeah, no, that's a good question, Ben. Thank you. So yeah, so there have been changes, like the residents that have come back from the hospitals to Forest Heights, they're not coming back to 3 and 4 ward rooms anymore. It's been capped at 2 per room. So there have been changes made, to some of the requirements for the homes in order to better protect residents in the future. So yes, for example, St. Mary's is in close contact with Forest Heights. They supervised Forest Heights for 90 days. And, if there's a need for them to potentially supervise a home, any of the hospitals, for any of the hospitals supervise a home, they will be ready to do so if needed. So that definitely there have been some changes, some improvements made in terms of the requirements for these homes. And there's a closer connection to partners that are able to assist, like hospitals, that are able to help out a home with managing a home if needed during an outbreak.
Okay, so will we see earlier action taken though if there is an outbreak at one of these homes?
I would say that, we don't, health partners are working together on this. And if there's a situation that we feel action needs to be taken, I think, we have mechanisms now that weren't necessarily available earlier on. And for example, for a hospital to take over a home, and we will use whatever mechanisms that we feel are needed. So we have more ability to act quickly, and we'll be using those mechanisms if needed. And when I'm talking about we, I need to really, clarify that it's the health system partners. And in fact, it might be best if you would ask, for example, Lee Fairclough, because really taking over a home would be something that potentially a hospital would do. So I may not have, all the specific information that you're looking for.
Okay, thank you. I appreciate it.
Okay, anyone else for questions? I am not seeing any hands up, so.
Joanna, did you
Dr.
have a hand? Sorry, I thought Joanna might have had. No.
Okay.
Okay.
So I think we can conclude today's media briefing. Thank you to everyone for joining us, and we will see you back here next week.
Thank you.
Take care.